Hey there, hi there, ho there, everyone. Welcome to our first Wednesday webinar of 2024. And I'm going to ask you, how are you doing? And so I paused because I really want to know, truly, how are you doing? Can you put that either in the chat comments? Let us know, truly, how are you doing? You know that people tend to say it in passing, but if you know me, I really stop and pause and wait for a response. So, how are you doing? And let's see if you guys can put that in your comments in chat. And as you do that, and let me know where you're tuning in from. I want us to take this moment right now just to become, whenever you're doing something, you're transitioning from whatever you were doing to right now joining us. Let's become centered right now and mindful. And if you're able to not be doing three different things, four at the same time, let's take the time to just do some mindful breathing, even for 30 seconds. So I'm going to walk you through that. So if you can plant your feet, both feet not crossed on the ground, or if you're laying down watching us, or even if you're in your car, maybe you're pulled over, plant your feet firmly. And you can either have your arms, your hands up or down, whatever is more comfortable. And let's do a couple of mindful breaths. And so, what we're going to do is we're going to breathe in for a count of three. We're going to hold for a count of three. And then we're going to exhale for a count of six. Get all of that out. We'll do that a couple of times. You can do that with your eyes open or closed. I'm going to close my eyes. And so, if you can join me, that would be great. So, we're going to start. Let's breathe in, hold, and release. Exhale. Breathe in, hold, and breathe out. One more time. Breathe in, hold for three, and exhale. Thank you. All right. And so I'm going to check your responses shortly, but I just wanted to say, hey, everybody, life is beautiful. And I think even in the beauty, there are times that, yes, we all endure stress, some level of perhaps some anxiety. Some of us get depressed and some of us get very low. And sometimes we may want to give up. And that's one of the reasons for being with you today, so that we can just have real talk about living real life. So today, our Wednesday webinar, and so we thank the grantor for allowing us to be able to put something like this on. And so this is part of our relationship with UC Irvine and our SEAL subaward. And so we're thankful. So today we're talking about anxiety, depression, and stress. And we're also going to be featuring I Believe in Therapy. And the creators are going to be joining us because we do believe in therapy and being able to reach out and speak with someone. So today we're going to be focusing on recognizing and managing anxiety, depression, and stress. And as I mentioned, we have the creators of I Believe in Therapy. We're so excited. It's also going to be interactive. We do want to hear from you. And so we have our staff, they're going to do something interactive with you as well. So before we continue, I wanted to just say again, thank you for joining us. This is our first Wednesday webinar. Also, this Friday, we have our first Authors Corner. And so please join us this Friday, 4 p.m. Pacific time. And I also wanted to mention as well, April 30th, even though that is not a Cayenne Wellness Center event, we 1000% support this event, Sickle Cell and Pregnancy by SC Red. And we all want you to mark your calendar, April 30th, and that begins at 4 p.m. Pacific time. So we definitely will be there, and we hope that you all will be there as well. All right, so why don't we transition? Oh, before we begin, I also want to just make sure that you all know that we have survey and we need to collect data. You'll always hear that we need to collect data, know that you guys are out there. And so if you can, um, I think the tech team, if they can share the event survey link. And so no matter where you all are listening to us from, if you can fill out that survey, that would be wonderful. We will remind you midway. And then, of course, we're going to remind you towards the end of our webinar. So we want to bring on our moderator. And so if you can bring on our moderator, Star Simmons.
Good afternoon, everyone.
Good afternoon. So, Star, phenomenal. She is currently one of our community health workers here in Orange County. And as you know, we cover the entire state and we have different community health workers, compassionate community health workers. But that's not all she does. Actually, she has been quite phenomenal and she's been instrumental in providing 504 and IEPs. And you may have seen her at our last year's 504 IEP webinar, Wednesday webinar. She's done this for us, many of you in the community over the years. So these are just a few things that she does. But I like to be able to turn this over to Star right now. And Star, take it away. Thank you for joining us.
Thank you, Dr. Rowley. Um, Thank you all for being here today. And I guess I'm going to introduce everyone that'll be joining us here today. So we will have on the agenda today will be the mental health, depression, and anxiety and stress, which will be done by myself and Ms. Shante Johnson Harris, as well as we have the team. There she goes. Good afternoon, Ms. Shante Harris. And then we also will have the team, I Believe in Therapy, and that is Miss Carly Cole Kevins. There she goes, also known as L. Also, Miss Heather Avant. Good afternoon, Miss Heather. And then lastly is Dr. Marjorie, I hope I pronounced this correctly, DeJoy. I am so sorry if I pronounced your name wrong.
Is Dr. Marjorie Dejoie Brewer.
Ah,
and she won't be joining us today,
okay.
but we will definitely just honor her and her participation in the campaign.
Great. Thank you so much for that correction. And then lastly, we'll have again Ms. Shante Johnson Harris, who will bring us our interactive activity. So that is our team for today. And I think we're going to get started. Am I correct? Okay. Let us go to our slide, please, for the mental health, depression, and anxiety. I think we're waiting for our slide to come on. I think we have some technical difficulties here. Bear with us. Thank you so very much. Again, good afternoon, everyone. Oh, I'm going to give this over to Ms. Shante Harris. She's going to handle this part.
Awesome. Thank you so much, Star. All right, everyone. I hope everyone is doing well today. So, going to be asking you just a few questions, but first, Like I said, I hope you all are doing well on this lovely Wednesday. I'm excited for today's session because I do believe in therapy. There was a time when I did not, due to religion and cultural norms. And over time, I learned to recognize symptoms of depression, stress, and anxiety. Many of us go throughout our days in push mode, and we rarely stop to focus on why we're not as happy as usual, or why we're not eating like normal, or why, you're not getting out of bed on time, or getting headaches constantly, or you're a bit short tempered than usual. I would like you all to take a moment or two to grab a pen and a pencil if possible, or you can use your word program if you're at your computer. Just grab a pen, paper, and I would like you to answer a series of questions I have to help you to recognize if you may be having some symptoms of anxiety, depression, and stress. Sometimes these symptoms might look normal or like it's a part of life because we're always running and moving. Sometimes we don't know when we're not okay. But without appropriate coping skills, resources, and support, these symptoms can become detrimental to our health or deadly. So I'll give you a couple of moments to grab a pen and a piece of paper. All right. All right. So I'll go ahead and read the first question slowly but surely, okay? So the first question is, do you have feelings of sadness, emptiness, or hopelessness? A lot of us, some of us may say no, they're happy all the time. But, like me, I'm one of those happy people all the time. I'm happy, happy, happy. But every blue moon, I'm like, hey, what's going on? What's wrong with me? So once again, I'm going to repeat the question because I did tell you I'll give you a couple of minutes to grab a pen and paper. So once again, do you have feelings of sadness, emptiness, or hopelessness? All right. The second question is, do you have difficulty concentrating, making decisions, or remembering things? Sometimes you're like, I totally forgot about that. And, sometimes, most of the time you're on your game and you don't really forget things, but every once in a while it may happen. Do you have difficulty concentrating, making decisions, or remembering things at times? Question number 3. Do you wake up in the middle of the night and have trouble going back to sleep? I know many of our warriors do. That's pretty common in warrior world. Number 4, do you have trouble relaxing? Do you find yourself, really antsy, up and about, can't stay calm, mind's always racing? And number 5, are you easily annoyed or irritable? You find yourself snapping on people, or, you're just not as calm as usual, a little short-tempered? Number 6, do you constantly feel afraid as if something awful might happen? This constant worry about the future. Do you have a constant feeling of nervousness, anxiousness, or are you on edge? Sometimes you just feel like all your senses are heightened. You don't know what's going on, And next question is, do you have trouble staying focused in the present moment? Is your mind everywhere? You're thinking about this, that, and the other, what happened the other day, what's going to happen next month? Or, do you have trouble staying focused in the present? Next question, how often do you feel overwhelmed with life? A lot of us, we find ourselves like, life is a lot to handle. Many of us have a lot of coping skills. We're able to handle it well. But sometimes even the best of us, it becomes problematic. So how often do you feel overwhelmed with life? Next question. Do you experience headaches or muscle tension? And, I know a lot of us, we experience it, occasionally. But, do you find yourself experiencing headaches out of the blue, when you really don't experience headaches on a regular basis, or, tension, just a lot of tension. You might find yourself sighing a lot. And last question. Do you feel like withdrawing from family, friends, and isolating yourself? So, with these questions, we want to really, take a look at what's going on with us. So please reflect on your answers as we enjoy our excellent presentation. Now back to Ms. Starr.
Thank you, Shante. I must say these questions are absolute great questions, because I speak for myself. I know I can answer yes to a few of those myself. So without further ado, let us go to the next slide for the presentation, please. Again, good afternoon, everyone. My name is Starlara Simmons. I am community health worker here. Next slide, please. Before we go to the presentation, I just want to put out this disclaimer. I am not a doctor. Also, I am not licensed to treat or diagnose anyone here today. And I want you all to feel comfortable and know that, number one, this is not a space for treatment or personal consultation. However, we are here to encourage everyone, no matter what your situation is. The number one thing is to take care of your body and take care of yourself. Next slide, please. So as Ms. Shante presented the questions to us, that would help us better understand and get a better, deeper look into understanding and addressing what depression, anxiety, and stress really looks like in our communities. And so what is depression? Well, depression is a mood disorder that causes a persistent feeling of sadness and loss of interest. And so you may have trouble doing your normal day-to-day activities. And sometimes you may feel like life isn't worth living, as she explained. So then as we look at depression, what does that time of depression look like, that time frame? Well, depression can be episodic. You can have episodes that occur most of the day or every day. It can be all day. And so as she mentioned in her pre-questionnaire, some of the symptoms may result as feeling sad, frustrated. You have a loss of interest or pleasure, tiredness, and lack of energy. There may even be some weight loss there, some anxiety, some agitation, some relentlessness, some feeling of worthiness, a worthless, or guilt, or even you're fixating on the past failures that you may have had, or self-blame. That self-blame thing is something that'll get you every time. And unexplained physical problems. Maybe you got some health issues that you can't seem to pinpoint where that originated from, such as back pains, headaches. And for many people, when you look at it, depression and symptoms usually are severe, that they will cause noticeable problems in your day-to-day activities. And so what is the residual effect of those symptoms? Well, those complications can happen, such as social isolation, as she mentioned, difficulty maintaining relationships, whether it be personal relationships, business relationships, loss of sleep, insomnia. And it can even transition over into a poor quality of life. And so when do we really look and seek what we call emergency? Well, first, let's look at some of those regulators, those things that will cause us to get into this situation of depression. And it would be things like life events. I mean, things happen. COVID happened, and that affected all of us, right? Genetics, medication, inherited traits such as, like we're speaking here today, sickle cell disease, hormones. But when we really want to seek that emergency and get help is if you relate to any of the symptoms that are mentioned above, Shantae mentioned, you know, it's important for you to reach out and seek mental health support and get treatment and talk to someone. And if you feel like you can't talk to someone right then and there, you know, that is a professional licensed person, maybe speak with someone in your church or a family member, but at least speak to someone you can trust. Don't try to hold on it yourself. Next slide, please. Am I okay? Can you guys hear me clearly? Okay. I just want to make sure. Now, again, now we're going to look at anxiety. We looked at depression. Let's look at what anxiety is. And you may find some similarities to these things. So what is anxiety? Anxiety is an emotion characterized by a feeling of tension. And again, Shantae mentioned that. Worried thoughts and physical changes like increased blood pressure. But anxiety is not always related to an underlying condition. Anxiety is definitely not fear, for sure. Because fear is that present moment. It's something that is present oriented right now. And what does that duration looks like when you look at anxiety? Now, this is very important because we just looked at depression. But anxiety is our body response to stress or perceived stress and fear. Natural anxiety will normally subside once that triggering event or that stressor has passed and our body has calmed down. So when you're looking at anxiety, it can be something, you know, such as, you know, social crowds, when you're in crowds, and maybe you just get anxiety, especially now since the COVID has happened, you know, you may have something like that. But those symptoms are things such as feeling worried, unease, uncertainty, irrational fear, fatigue, insomnia, worry. Maybe some of you have lack of concentration. Again, that word agitation is there. Sickness is there. And then a sudden feeling of panic. And so what are the complications of those symptoms? Well, some of those complications of anxiety are panic attacks. And again, it goes right back to that first one we spoke about, depression or phobias and stress. So what are some of those things that can trigger us? What are some of those triggers? It could be chronic medical condition, your environmental stress, financial concerns. You know, if we got kids in school, you know, that's definitely one. Alcohol, drugs, family history, emotional trauma. And so when do we seek emergency help when we're dealing with anxiety? Well, if anxiety is preventing you from sleeping, working, socializing, or just even completing your daily tasks, it's important for you to seek help. Additionally, if you are experiencing symptoms such as racing heartbeat, sweating, insomnia, nausea to that anxiety, it is very crucial for you to seek a professional help. Someone that is professional, whether you go to the ER, maybe you're having a panic attack, you just don't know, but it's important to do that. Next slide, please. And so lastly, when we're understanding and addressing depression, anxiety, we're going to look at stress in our communities. So how is stress defined? Stress is applied pressure or tension. It's a change that causes physical, emotional, psychological strain. It's a condition of anxiety or mental strain brought on by a challenging circumstance. It could be anything from a sickle cell crisis or, you know, just stress trying to make it through the day and meet the deadlines. We can pick one. And what is the time duration? What does that look like when we're dealing with stress? Well, I think we all can answer that one. But there are technically, they say there are 3 durations of stress. There is something called acute stress, which is brief, it's episodic stress. Then you have something which is short term, and then something that is chronic stress, which is prolonged. That's long lasting. And so some of those symptoms may look like, as I mentioned, stress can be short term or long term. But regardless, both can lead to a variety of symptoms. But chronic stress can lead to more serious issues such as complications with your body. Symptoms can include, but they are not definitely limited to being anxious or having headaches or grinding your teeth. I find myself grinding my teeth sometimes. Low energy, as again, Ashante mentioned, muscle tension. Maybe you see a change in your mood. And even again, frequent sicknesses that you just cannot explain. So these all look so familiar. And what type of complications will come from stress? Well, stress can cause some physical changes, as she just mentioned, Shantae, fatigue, weight loss, gain, breathing problems, sleep disorders, headaches, mood swings, a variety of things. But what brings on stress? Well, we know there's a lot of different things that bring on, but we have a few here. It can be that fight or flight pressure. It's time to go. Or it can be financial issues again. It can be parenting. Okay, that's mine's right there. Parenting is definitely mine. You start worried about things that are not even there. You're just stressing to be stressing. And it can be relationships, and relationships doesn't necessarily have to be personal. They can be professional relationships. You know, maybe there's contracts involved, who knows? And then that everything that we call everyday thing called work. We all got to work. And then again, it could be something that's traumatic, some type of traumatic event, a loss of a loved one, or just something that you're watching on television that you see this happening in your community. Next slide, please. And so now that we have recognized and identified our triggers of depression and anxiety and stress, the big question is, what do we do next? Now that we have this information and we know that, okay, these are my symptoms or my signs and symptoms. So the first thing that we're going to do is we're going to say, where are we going to go from here? Well, after recognizing the signs, the reasons and the challenges of depression, anxiety, and stress, the next step, there are multiple choices that we can do. You know, there's multiple ways that we can address the depression, we can address the stress, we can address the anxiety. So the key here is to know that no matter what you're dealing with, stress, anxiety, or depression, is that you don't have to struggle in silence. Thanks to Kion Wellness and its entire team here today, that we know that we have someone that we can go to. They're giving us information. And so thank you again. And so that's the thing. That's the good news, is today that we accept the fact that we've taken the questionnaire that Shantae has given us. And we recognize that the information that we see here, and now that chain of depression, anxiety, and stress can be broken, because now we see that there's hope. So now there has to be a plan. Now that I know I have hope, what is that plan? What does it look like? Well, guess what? The good thing is, it's always about meeting us where we are. We're here today to say, I'm dealing with this. So today we have been given that second chance. Yesterday is no more. I'm not even going to worry about the stress from yesterday. I'm going to worry about what I can do today to make it better. And so the first thing we want to do is give ourselves grace. We go back to that page before where we were saying that, hey, we don't have to struggle alone. We don't have to deal with these things on our own. And so one of those ways that we can handle things is that we just practice mindfulness. I love being on this team at Kion Wellness, because that is definitely one thing that I know this team does. They practice mindfulness. Then that means to be present in the moment. Stop focusing on the things that we cannot control. Yesterday is gone. Today is here. So right now I'm in the moment. And more importantly, we need to communicate. It's okay to ask for help. I believe in therapy, like Shantae said. I believe it's important, it's valuable. And so we're going to seek the professional help which we have a great team that's coming up right after us that can give us all the help that we need. Next slide, please. And so the treatments of those supportive services that are available to us, but not limited to the ones that are mentioned here today, which are support groups. I know that Cayenne Wellness, and there's so many support groups out there. There are numerous support groups available to yourself and to myself, such as Cayenne Wellness. They offer all kind of assistance in coping and managing and dealing with difficulties such as depression, anxiety, and stress. And then you have something called psychotherapy, which again, I am not a doctor, but again, I'm just mentioning these are treatments that are available and services. And that focuses on cognitive behavioral therapy. It focuses on changing the negative thoughts and which contributes to our depression and our anxiety. And the negative influences that come with all of those things. And then we have holistic therapy. That's something we always practice as well, is that mindfulness. And that's based on, I'm just going to be quiet and just take a breath. And this therapeutic technique, it's like things like yoga and meditation. And it's used to help those individuals to deal with depression and chronic pain and immune disorders such as, sickle cell and things like that, and other stressors. And then lastly, again, we'll have professionals here to speak about medication. That's where you would seek a healthcare professional who can support your unique needs, whatever that may be. Next slide, please. And I think that's me. So thank you all so very much for allowing me to bring this to you. And thank you, Ms. Shante, for allowing me to be able to shadow you. I thank you so very much, my great leader.
Thank you, Star. I appreciate you and everything that you do. Thank you.
And I think we go on and I can introduce the next person. And this is Miss Carly Cole Cavins, known as Miss L, and I believe in therapy. I'll pass it on to you.
Thank you so much. That was fantastic. I just enjoyed listening to you so much because I know as a caregiver to my daughter who's 15, it's been a long journey. And I think for those of us in the sickle cell community, it is a journey that we all know in our own personal experiences. So I'm just grateful that you were able to share your slides and, let us know that our feelings, regardless of what they are normal, that we're not alone in the way that we feel. So it was very just eye-opening. So I appreciated the information that you shared. Hi, Heather. Welcome.
Hi, Carly.
So go ahead and I'm going to ask Joy if you could put up our slides. We have a few slides that we want to share as well. Thank you. So what you're seeing on the screen is the three of us. It is Heather, myself, and Dr. Marjorie Desjoie Brewer. We all participated in a campaign called I Believe in Therapy. And this was in partnership with the Sickle Cell Disease Association of America. Next slide, please. So the campaign is sponsored by the Sickle Cell Disease Association of America, my company, which is Cleverly Changing LLC, and Pfizer. So we all worked together to make sure that our community had a personalized campaign that mattered to each of us about mental health. Next slide. So Heather, can you talk a little bit about behind the campaign and who each of us are?
So thank you so much, Carly, for handing it off. The campaign, can you all hear me? Okay.
Yes.
Technical difficulties today. I've gotten kicked out quite a bit this afternoon, but the campaign it came up in a conversation that we were having in regards to how do we spread the word about therapy. There's such a stigma, especially in the sickle cell community, about therapy. It's always, well, is it that bad, or is life that hard? ideally, yes, it is. For many warriors out there, life is hard and it is difficult. So our goal was to build a unifying message and have warriors, um, caregivers, and advocates back up that message and really dig deep into kind of understanding that we all believe in therapy. So I'm going to give 100% of the credit to the idea is Carly's, is Elle Cole's, as you all know her. This idea was hers, and I thought it was too important to drop the ball on this. We needed to move forward because I felt that as a sickle cell community, as a warrior myself, I felt that there was nothing more important than getting this message out there. And I wasn't sure how we were going to do it. So it was a lot of brainstorming and kind of talking to people and figuring out what platform could hold this campaign because I still believe in the power of it. There's such an importance when it comes to everyone and the idea of therapy and getting the star names behind it, getting the faces that you all know and trust that we see in the community behind it was such an honor. And Carly has done the lion's share. Dr. Deidra Brewer came on because we did need someone who had mental health and had a health background, right? We're not going to go out here rogue telling you what you should do or even offering resources. We knew that we needed to invite someone in. And Dr. Deidra Brewer was more than happy to step in and kind of be like our medical advisor and really open up. And I'm sure you guys have seen her on the Mental Health and Wellness Initiative through SC3, but she was a really great foundation or cornerstone for this project.
Thank you. That was well said, Heather. It was definitely teamwork for each of us. And I'm just so glad that it's something that our community can call its own. Next slide, please. So our goals with the I Believe in Therapy campaign is number one, to erase the stigma of therapy. Star just talked about that, and it's so important as people in the sickle cell disease community to make sure that our mental health is just as important as our physical health. The goal number two is to create a positive outlook around counseling. And the third goal is to provide real, reliable mental health resources. So we're not just saying, look, we recognize and believe in therapy. Yeah, I feel like we all know that. Mental health is now one of those popular buzzwords that we hear in the community, but we're not just throwing it out there without resources, because once we say this is important, we also have to give people next steps. Where do you turn? Where do you find resources? Where do you find a therapist that you can relate to? Next slide, please. So I'm not sure if we could play that again with sound so that people can hear it. So while our tech team is bringing that up, we want to make sure that you guys can hear the campaign. This is one of the clips. We have many different clips. And this was our men who participated in the campaign. And I want to make sure that you can hear it so that you know exactly what we're talking about. And if you have seen this campaign, please put in the chat whether or not you have seen it, and let us know what you thought about the I Believe in Therapy campaign.
Absolutely. Your feedback is imperative for anything that we do, especially when it comes to mental health, because without you, we're not successful. We really want to hear from you because we want this to grow. We think that this could be a movement, especially amongst the sickle cell community.
Yes, we don't want it just to be us and, the friends that we have that participated. We want it to be something that the community can all say they took part in.
I believe in therapy.
I believe in therapy.
I believe in therapy.
Visit sicklecelldisease.org to learn more about how therapy can make a difference in your life. Together, let's prioritize mental health and thrive on our journey with sickle cell disease.
Next slide.
I believe in therapy.
I believe in therapy. I believe in therapy.
Visit sicklecelldisease.org to learn more about how therapy can make a difference in your life. Together, let's prioritize mental health and thrive on our journey with sickle cell disease.
Thank you so much for sharing that. We have a comment in the chat. It's from Carla, and it says, I've seen it and loved it. We love that you've seen it, Carla. That definitely warms our heart, right, Heather?
Absolutely. We've actually put a lot of work into this, into the campaign itself, and we're continuing to work on it this year. We look forward to rolling out new things and new ideas, and because we want everyone to understand that there shouldn't be a stigma behind therapy. So we want everyone to know that not only do we all believe in therapy, we all go to therapy, we all participate. It's not something that we just say just to say it.
Yes. And the first video that you saw, it was men. It was male sickle cell warriors saying, I believe in therapy. Sometimes we don't get to hear the male voice. Sometimes we just hear from females. And I feel like it was very important for us to be able to show different people, not just, one type of person, not just one type of warrior, but different types of warriors with different genotypes. So we have those varieties a part of this campaign. Next slide, please. So if you could bring Shantae up onto the screen, she's going to conduct an interview with Heather and I and just ask us a few questions about the campaign. While she is coming up, I will start with, I'll ask Heather that first question. Oh, so Shantae is here. So go ahead, Shantae.
Hello, everyone. I didn't realize that I had my camera off. Pardon me. Yes. So, okay. So, number one, do you have feelings of sadness, emptiness, or hopelessness?
You're asking both of us?
So the question, I don't know if you can see the question on your screen. It says to Elle, Cole, and Heather, what inspired the inception of the I Believe in Therapy campaign?
And okay. No, I thought when you asked me, pardon me. Okay, here we are. Okay, I got it. All right, now. Yes, to Elle, Cole, and Heather Avant. Okay, hello, you two. So what inspired the inception of the I Believe in Therapy campaign? And what specific challenges within the Black community prompted its creation?
Carly, I talked a little bit about this, so I'll let you take this one.
So just like Heather said, we were in a meeting and everybody just felt extra charged when we began to talk about therapy. And it was mainly because we were in a meeting that deals a lot with curative therapies and finding a cure for sickle cell. And I think we all want the hope of there being a cure for sickle cell disease, but we know that it's a long journey. And along that journey, there's going to be different mental health aspects for each person involved. So not just the warrior themselves, but their caregiver, their family, their friends, their spouses, their coworkers, their medical professionals, like literally everyone who interacts with someone is going to have some different challenges. It's going to show up in different ways. And in the sickle cell disease community, we become so passionate about each other, and we live in a space where we're constantly faced with grief. And it doesn't have to always be the loss of a person. Sometimes it's the loss of certain dreams and, certain things. And so we haven't necessarily done a job of addressing that. And so with this campaign, we knew that it would kind of be an opening to allow us to talk freely about things that were happening And for many of us, we said, hey, growing up, I didn't feel comfortable talking about counseling or needing a therapist in my home. I know in my home personally, my mom would say, just take it to Jesus. I definitely, as a Christian, I totally accept that, but I knew I needed more. I needed to be able to talk to somebody here on earth who I could say, hey, this is what's going on in my life. And I need some suggestions. And I didn't always want to, tell my friends because they didn't necessarily have the mental capacity to deal with the heaviness of what I was sharing. So finding a professional that was skilled to listen was critical for me.
And I want to just add just to that, just for a second, but that last part that Carly said is that, we get caught up in talking to our friends, but our friends don't have the skills necessary to offer the help that we potentially need. And all of us, I think, we're really good at talking to our friends and unloading on them and receiving information back, but it's not always going to be what you really need to heal the inner self. So just wanted to add to that our friends, while we call them our therapists, ideally, unless your best friend is a therapist, and even then, I think that there's a conflict of interest. You need to talk to someone. You need to get that out. You need someone to sit you down and really kind of do a deep dive with you, because we can sometimes end up relying on our friends quite a bit for our personal stresses, especially as sickle cell warriors. And it is really hard for a lot of people out there to understand what it is that we as sickle cell population go through.
Absolutely. Next slide, please.
All right. And then also, I just wanted to add to that too, because when I talked about religion and cultural norms, that's what we always used to say, hey, give it to God, and that's what I went to all the time. And then also, Miss Yvonne, I wanted to state also that our friends sometimes will get on their nerves. So we need someone else. And they won't want to be around us too much, depending on that friend, because it's like we'll be Debbie Downers, So, all right. So, Miss L. Cole, you've been instrumental in the campaign's development. Could you elaborate on the strategies employed to destigmatize therapy within the Black community effectively?
Yes, we just really touched on several things. You really brought it home. And what we were trying to do is really make it feel normal. When it's normal to seek therapy and counseling, it's not a question what we're doing. Nobody's second guessing us. And I feel like now we've moved into a space where often we do feel more comfortable. But in the sickle cell disease community, I wanted to make sure it was leaders within the community, like people that other people would be able to recognize and say, hey, I know Dima, I know her story, or I know Wumi, I know her story, I know Heather. I can relate to what Heather has been through. And I wanted them to be able to do that in various ways. So if you look at the campaign in its entirety, you'll see that it's different types of people. There are medical professionals, there are sickle cell warriors, there are caregivers. So they're coming to the table to really share that, hey, I seek therapy because it's important to me. And I feel like because it's on social media, it's something that people can just stumble across. And the people that it's not, stock photos, it's not a video that was created with AI. It's like we are living this. And so I felt like it was something that as community members, we could say, hey, we're in this together and we can do this together. So that's really the way that we've tried to destigmatize therapy in the community by showing, hey, even your doctor goes to therapy because it's important. So
Absolutely.
Next slide, please.
All right, Ms. Heather Yvonne, what role did gender dynamics play in shaping the campaign's messaging and outreach efforts, particularly considering the inclusion of both men and women as advocates for counseling?
Okay, and so this is for all my lovely warriors out there, but we see women confessing their mental health needs a lot more often than we hear our men. So it was very important for Carly, Dr. Dejois, and I to find the men. And boy, did we have to track them down. But we thought it was very important that they shared their stories. Because again, women we're more inclined to receive that, to receive, yeah, I probably should go talk to someone, or I'm looking for a therapist now, like I saw Carla in the chat. But our men, they need help too, and sometimes they need help recognizing that they need help. But seeing a peer and seeing another male peer, especially someone who is known within the community, up there saying, yeah, I believe in therapy, like I'm a man and I do this and I go to therapy, we were like, there's power there, right? There's so much power in those young men, in their words. And so it was very important because they're advocates from across the spectrum. So it was very, very, very important for us to really showcase our men. And, while our women are just as important, we're not sitting here knocking down our women, but we know as females and ladies, y'all know, we will be like, let me go to therapy, and we're a little bit more inclined, not everyone, but we are more inclined to listen to our female friends, where men sometimes need a little push. So it was so important, and we really did, we really did have to, work on our guys to get them there. There's a lot of soft convincing, if you know what I mean. If you guys know me in this space or out there in the ether, you know that what soft convincing means for me. So, but we were able to get them and capture them and hear their voices in this campaign. So it was very important.
Absolutely. I love what you just shared, soft convincing. I'm going to have to use that term myself. Next slide, please.
Elle Cole and Heather Avant. The campaign utilized the toolkit to disseminate resources on self-care and counseling. Can you discuss the contents of this toolkit and how it aids in empowering individuals to prioritize their mental health?
Yes, I just dropped the link to the toolkit in the chat. And when we're done, at the last slide, there will be another opportunity for you to scan the QR code and go to visit the toolkit. But the toolkit itself, we talked about resources and how important they are. And so in the toolkit, we share, different companies that are offering counseling. Cayenne Wellness, to me, is doing a phenomenal job about paying for therapy for sickle cell warriors and their families. And so if you are in California, this is a benefit that you have. It's not free because Cayenne Wellness is actually paying for it. So it is no cost to you as a client. However, it is important to make sure that you attend and go to those appointments because Cayenne Wellness Center is paying for it. But I truly wish everyone in the sickle cell community had this resource at their disposal. I'm located in Maryland, and I really wish Maryland had this resource because for me, getting counseling and therapy is very important, but it's something that I have to pay out of pocket for. But I feel like it's something that's so important for all people. I hope that other organizations will work together to make sure that they can provide counseling for their members, just like Cayenne Wellness does. In addition to providing that information about therapy, there's counseling and support groups, self-care activities, and the Sickle Cell Community Consortium and also Sick Cells, they both have pages that have additional resources about counseling and mental health resources. Heather, I'm going to let you talk about the mental health initiative that the Sickle Cell Community Consortium is doing.
So the Sickle Cell Community Consortium created a mental health and wellness initiative over quite a few many years ago. And up until recently, I was the co-chair of that with Dr. Dejois Brewer. And the goal was to really talk about talk about your feelings, right? We were talking about our feelings. We were talking about what it means to be a whole mind and body health. That included everything from nutrition. We are on a little bit of a break right now, but it was a cohesive plan, and I understand, and it is my understanding that it is coming back, and it's not gone forever. However, it is on a little bit of a hiatus because, as we know, these programs take a lot of time and a lot of effort. But the program really was all encompassing. Our own very own Dr. Raleigh was on our Sunday night sessions every Sunday night, and occasionally Thursday nights when we switched it up a little bit. But the program was really talking about all voluntary but whole health. And we had to do things. We were able to kind of teach deep breathing exercises, which I still use to this day. We were able to teach movement and yoga and really do a deep dive into how your body reacts to certain stimuli. And it's a really great initiative. And I look forward to seeing what they have in store for the future.
Absolutely. And I just want to say, even though there aren't new sessions right now, there are replays that you can watch. You can go onto the Sickle Cell Community Consortium Facebook page and watch the replays. It's so timeless. It doesn't get old. It's something that, if you need those deep breathing practices, you can definitely continue to learn. Just press replay and watch it. And so I definitely encourage people to take advantage of that. But also in the toolkit, it talks about apps that can help you kind of monitor your moods and monitor how sickle cell is affecting you or your loved one. So there's a lot of information in that toolkit. So I just encourage everybody to go there and see exactly the information that it shares. So it also talks about goal setting. And I think it's important for us to kind of have hope for the future. And sometimes we need to be prompted with that. And so definitely check out the toolkit. The website is sicklecelldisease.org/mental health and wellness. And there are hyphens in between there. So if you go to the website, sicklecelldisease.org, you will see in their slider, you'll see one of the images that points to the I Believe in Therapy campaign. And that's one way to go to the toolkit as well. Next slide, please.
Heather Avant, in terms of long-term impact, how do you envision the I Believe in Therapy campaign influencing attitudes towards mental health within the Black community?
And I've touched on this a little bit earlier. So let's just kind of go back to what I said is we really do need your voices within the community. And it's always a call to action, right? We need to continue to push out and to bring our brothers and sisters out there, especially our sickle brothers and sisters out there and help them go into therapy. I can speak from experiences that each time you have a sickle cell crisis and are admitted to a hospital, that is a traumatic life event. And so many of us aren't talking about those instances. We kind of brush over them like that's just a matter of our life. However, that is built up trauma. Many of us, including myself, have years. I have 43 years of built up trauma, and it has to go somewhere. And so that all that trauma can eat at you. So my goal is, and the call to action to you is for the future is to push this campaign. We want to see your videos of you believing. If you believe in therapy, we want to see you post on social media. We want to see you really speak out about it, because I want everyone to feel safe. I want it to be a safety bubble of inclusion, and that it is okay to seek the care and the help that you need, especially when it comes to your emotions. I have a friend of mine who says all the time, and she happens to be a doctor, and she says to me, it's easier to heal the body than it is to mind. And if you think about that as warriors and what that holds in the power, it's easier to heal our bodies than it is to heal the mind. The mind is a very complex thing. So I want you all out there to really share and to encourage people when you see them hurting and you see them really struggling with life issues to go and get therapy, to talk to someone.
Absolutely. Thank you so much for sharing that, Heather. Next slide, please.
Elle Cole, what steps can be taken on a societal level to ensure that therapy remains accessible and culturally competent for Black individuals beyond the scope of this campaign?
First and foremost, I think we have to be honest with ourselves, and we can't, you know, hide behind the fact that we go to therapy. The I Believe in Therapy campaign is all about really saying it and being proud to be someone who takes their mental health seriously and prioritizes mental health. When I first started doing the Caregiver Summit 3 years ago, it'll be 4 years this November, I was telling everybody, hey, as a caregiver, you also have to seek therapy. But I'll be honest with you, it wasn't until that first year that I did it that I said, look, I have to practice what I preach and I have to go. So by saying that to other people and telling them to seek therapy, I signed up myself and made it a priority. And I'm telling people, hey, I am somebody that has found a therapist. Sometimes you have to vet the person to make sure they're the right person from you. And so that includes asking questions, knowing what is of value to you. So for me personally, as a Black woman, I wanted a therapist who was also a Black woman. As a Christian, I wanted someone who had Christian values. So those are the things that I ask for when I encouraged when I sought out a therapist. Those are some of the questions that I had and that I prioritized. And so just because you find a therapist doesn't mean you have to stick with that one person. And so I think it's by doing campaigns like this and sharing on social media, wearing t-shirts or hoodies that says, I believe in therapy, we're breaking down that stigma. And we're making it more accessible by sharing resources. NAMI is an organization where people can learn more about different therapists, Psychology Today. There are many different therapists on there, but if you are a person who isn't in California and you're not getting that free mental health counseling, you can check with your insurance or your job if you are working. A lot of times jobs will have a certain number of mental health. It's called behavioral health resources. And so you may have a number of sessions that are tied into your insurance, but you have to seek that out. For some reason, it doesn't automatically, like you may not automatically find out about it. You have to ask. And I think it's very important to do that.
Next slide.
Next slide, please.
Thanks.
So while we're waiting for the next slide, I'm going to read one of the comments, and it says, thanks. It says, L, thanks. Yes, following your own advice creates buy-in. Yes, it is important. As a parent, you can tell your kids to do things, but if you're not modeling that behavior, they may not.
Right.
So, and I see Carla says, I use deep breathing as well. That's something that we all can do, and it's very important. Sometimes I know, like when I'm driving, sometimes we can be in traffic and back to back, and sometimes you'll want to be angry with other people. Taking a few seconds to do deep breathing, it doesn't cost anything, it's free, and it will calm you all the way down. So I love that. Carla also says soft encouragement. Yes, yes. So I see that the next question is up, and I'm going to give you the floor, Shantae.
All right. Now, to both of you, what personal anecdotes or experiences have shaped your commitment to advocating for mental health awareness within the Black community? And how do you hope to the I Believe in Therapy campaign will leave a lasting legacy in this regard?
So I'll start a little bit. So I can tell you a little bit about my backstory. I went to therapy when I was my first time in therapy. I was probably in my mid-20s, and I lost a friend who had sickle cell. And it hit me a lot harder than I thought, but it didn't hit me right away. It took me quite some time. So there was like I want to say a 4 to 5 month delay in how and when it hit me. And I remember going to the doctor, and I was like, I just have this pain. Like my chest just feels like it's always hurting. And he was like, yeah, that's not normal. And he sent me around for all the usual sickle testing, EKGs and echoes. And he's like, oh, everything looks good. And he's like, how are you and then he asked me, how are you coping with your friend's death? And I was like, oh, I'm fine. That's our default answer. And it was after a couple of sessions of talking to him, he was like, I really think you should go talk to someone. I feel like you're maybe struggling a little bit more than you realize. And sure enough, I really had a hard time processing her death. Because as a warrior, when you have a warrior who dies, who's close to you, it brings in thoughts of mortality. And those are very scary thoughts when you're doing it and you're trying to cope and trying to reason it with your own mind. So I hope that this campaign will help those who are really struggling. Like, I'm fine, I'm good, I don't need that hobo jobo, or I therapize myself. I have heard that before, and I'm like, girl, go get you some therapy. You ain't not therapizing yourself. Can't nobody, because you really can't hold the mirror up to yourself and see your own blind spots. That is very hard to do for anyone. I don't think anyone is really capable of looking at their blind spots. So for me, that was like my intro into therapy. And then this campaign coming about, I think was timely, because we have so many warriors right now who struggled after COVID and who are still struggling, right? Who are struggling with career, struggling with family, struggling with just life itself. Because as I said, life be lifing, you can't escape it. So our goal is to continue to push out to continue to push out the initiative, to continue to push out the fact that I truly believe in therapy. I use it on myself. I am the biggest proponent for it. I want you, if you're hurting or if you're just stressed out and things are just a little out of hand, I say when I'm dropping balls is when I have to go back, because I shouldn't drop balls. And it's just, for me, it's one of my notes to self that I need to go back to therapy because I'm dropping too many balls. And we talk a little bit about that. It's in the comments. Yeah, Kiera, I get you. But there, you have to really think about yourself. And also remember, your joy and happiness as a human being, who you are, affects everyone else around you. And if you're coming in slamming doors and screaming, everyone else around you is experiencing that too. And they're like, oh my gosh. And we make jokes about that, right? We're like, oh my, someone's got a bad mood. However, there could be some real substantial basis behind that to go and talk to someone.
Absolutely. For me, I think my entry as a mom, I was just feeling overwhelmed. A part of me being a mother to a child with sickle cell disease, I chose to leave my job. And I really had invested every waking hour of my time in my kids. And there's nothing wrong with that per se, but I had kind of lost myself. And I only, I was just kind of going with the motions. And I realized that if I continued along that path, I was going to be depressed. And so it was kind of like a wake-up call. I began to prioritize self-care. I really didn't see my mother practicing self-care, so I didn't know what it was, and I didn't want to appear selfish by doing things for myself. So in those early stages, it was really hard for me. And so by seeking therapy and taking time out to find out what I needed to do to relax so I could be a whole person, so I could dream again, so I could have hope, so I could smile, so I could just do things. It was really important for me to be honest with myself and say, hey, you need to talk to somebody. And I was able to do that without shame. I was able to tell my sisters and my family, this is something that I have to prioritize. And in doing so, it really helped me learn how to set boundaries. It's something I am still learning. I'm still on the journey to set proper boundaries, but I feel like I'm so much more capable now because I know what's important to me. And so for me, the I Believe in Therapy campaign is saying you are not alone to everybody in the sickle cell community and saying this is something that we as a community can champion. And so I want the legacy to be people seeking therapy for themselves and saying, I can put this in my tool belt because I know that we live in a constant state of grief, just in different ways. Even me, one of the advocates that really made a difference and helped me become a sickle cell disease advocate, he passed away. His name was Shakir Cannon, and I just really looked up to him. And so it was hard, you know, being on this journey and being a part of the community. Sometimes you lose people that you love and respect. And it's important to be able to grieve in a healthy way, and to grieve differently and take ownership of that, because grief just shows up in different ways. And so I needed a healthy way to process it all, to process being a sickle cell advocate, to process being a mom to a child with a chronic illness, and to be able to show up as myself and feel like I can give myself grace to do that. So that's really what I want, that I believe in therapy to be for other people. I want it to be a symbol of grace, where you're saying, hey, I got this. And I know that my brothers and sisters have my back because they're seeking therapy too.
Very well said, Carly.
Next slide, please.
I believe in therapy.
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 I am in therapy, and therapy has really helped me with being a mom to a 7-year-old warrior.
I'm in therapy, and therapy has helped me cope with my challenges as a patient and a physician.
I'm in therapy. Therapy has helped me with advocating for sickle cell as a sickle cell warrior.
I am in therapy. Therapy helps me with my mental health with sickle cell disease.
I'm in therapy. Therapy has helped me heal past traumas as a sickle cell warrior. Therapy has helped me power through survivor's guilt and adjust to my new identity as a stem cell transplant survivor.
Therapy makes a difference.
Therapy makes a difference.
Therapy makes a difference.
Therapy makes a difference.
Therapy makes a difference. Therapy makes a difference.
Mental health is critical to overall well-being, and it's no different for individuals living with sickle cell disease. In the United States alone, over 100,000 people live with sickle cell disease. Remember, mental wellness is just as important as physical wellness. The Sickle Cell Disease Association of America is here to support you every step of the way. Visit sicklecelldisease.org to learn more about how therapy can make a difference in your life. Together, let's prioritize mental health and thrive on our journey with sickle cell disease.
Carly, you're muted.
So everybody, that was the full campaign. I am so proud of it. I am proud of everybody who was able to participate and who were willing to share that they believe in therapy. Heather, can you tell everybody just, next steps?
So our next steps is our ask, right? And I mentioned this a little bit earlier, but our ask is for you to go out there and share this message. For those of you who feel like the tug towards therapy and talking about yourself or kind of doing a deep dive, do it. You have friends and warriors and people who stand behind you who want to encourage you. And if you need encouragement, you let us know. We'll be there to champion you on. Unfortunately, you can't see the square, but if you got a chance to click on our little QR code, you can go to the website, check it out, read about all of the tools that we have put in place for everyone. It's important that that you go and you if you need that and you feel that pull, and even if you don't, maybe you're just like, I'm not sure where I am. Shanti asked some really good questions earlier. If you answered yes to many of those questions, I mean, I answered yes to a few, and I am in therapy because it's like, oh, girl, you got to get your life. So if you feel a tug, we will champion behind you. And if you would like to share this message, we encourage you to do so. We encourage you to put it out there and also create your own videos. Do you believe in therapy? We want to see how many out there believes in therapy, and if that's something that that you're called to do. But we would definitely love to champion you in sending out your own message and creating and continuing this message and moving it forward.
For those of you who weren't able to click on the link in the chat right now, the QR code is on the screen. If you scan that QR code, you'll be able to go to the page that has the toolkit, and you'll be able to access the toolkit. So scan the QR code and go to sicklecelldisease.org to be able to access those resources.
Well, that's all we have for you today. Dr. Raleigh's up, so are you?
All right, everyone, can we get a hand clap, wave, amen? This was awesome. This was phenomenal. This was great. This was right on time. I know that KW said this is so relatable coming from the community, and it is. And so I'm so proud of the people in our community that continue to think outside the box and outreach and what else can we do? How else can we support? I'm just thankful and grateful. This is wonderful. Before I give my closing remarks, I know we started with Star as the moderator. So Star, I would like to turn this to you to see if you have any final remarks. And of course, I'm going to check in with both Elle and Heather and Shantae. But first, Star, do you have any closing remarks? This was a phenomenal, and I am going to read. I have the full grantee information, so I need to be able to thank them. But final remarks, Star?
Yes. First of all, thank you, Dr. Rowley, for being such an awesome leader. And we thank you for this opportunity, because we would be remiss without giving you a thank you for giving us the opportunity to continue to serve the people. So thank you. Miss L. Cole, thank you so very much for your compassion and your empathy and sympathy for the sickle cell community and what you're doing, not only as a caregiver, but as a mother and advocating your own rights. And Miss Heather Avant, thank you so very much, just for your grace and your meekness. And again, you and Elle just hit it on the spot. As a parent of a sickle cell patient to myself, I can truly see your sincerity when it comes to the community. So I believe that we're in good hands with people like the two of you leading us. And of course, Miss Shantae Johnson Harris, the one that I'm trying to follow behind. Thank you so very much for always doing things in excellence. And thank you for your leadership in the community as well. And now I'll return it back over. And of course, lastly, I'm sorry, the community. Thank you all for attending today. Thank you so very much for allowing us to serve you. And I'll give it back to you, Dr. Rowley.
And I want to also make sure that we mention Dr. Marjorie. Very instrumental. If you all remember partnering with SC3, Sickle Cell Community Consortium, mental health has been at one of the key areas that we need to continue to move forward and to have people become aware. So this is just yet another extension but with Dr. Marjorie, Heather, and Elle. So we're thankful. Couple of things, and we don't want you all to go yet. So a couple of things. Uh, Now, remember I mentioned that survey, right? So we need to hear from you. And so I mentioned that at the beginning, and I wasn't able to mention in the middle, but we're mentioning it right now. And we need for you all to take a look at that. It doesn't take long, and so please fill that out. And you can take a screenshot, or it's also in the comment, and you can just click on that, and that'll be great. Let me do it this right now. I want to be able to just read. Um, to thank the grantor. This work was supported by the National Institutes of Health, the National Health, Lung, and Blood Institute, the Community Engagement Alliance Against COVID-19 Disparities, grant number 21-312-021-7571-66106L. Woo! And the National Center for Advancing Translational Sciences of the NHI Award. That's a mouthful, but this was the grantor that provided funding for us to be able to put this on, as well as Star and Shantae for having gone to those meetings. They were very dedicated in going to those meetings on depression, mental health, depression, anxiety, and stress. All right. Elle, final remarks.
I just wanted to charge the community and challenge each person to find the best way for you to check on your personal mental health. It is something that you have to prioritize and you have to take ownership of. Each one of us is telling you how we've made it a priority in our lives. And so now it's time for you to do the same. And so I just challenge you to do that for you. Start today. And you can start with practicing self-care and work up to getting a therapist. But I think it's something that every person in our community, if not in our world, needs to prioritize. So I just challenge you to do that today.
Thank you. Heather.
Well, first I want to say thank you, Dr. Rowley, for inviting me and Carly and Dr. Dejwa, who is unable to be here with us to present this. Dr. Raleigh knows, and I'll share a little bit about you, audience, that we have worked on this. We were hard at work on this for some time, and we were so proud to see it come to life and have life breathed into it. So I just want to thank you ladies on the stage, and Dr. Dejwa, who is not here with us. And again, I encourage you to take a moment, take stock on where you are today, and really listen to yourself. Listen to what yourself is telling yourself, right? Listen to how you're feeling. Answer those questions. Be honest with yourself, because that's sometimes very hard for us to do, especially in our community, and especially as strong Black women. We're told to just keep moving. And oftentimes we do that, So really take stock in where you are and really think about that and give yourself grace, but talk to someone as well.
Thank you. And Shantae.
Thank you, Dr. Raleigh. Just like Star, I just want to make sure I grace you and tell you thank you so much for providing us this platform. And you're always just so pleasant, loving, and we always look forward to having you. So thank you. And also thank you so much, Miss Star, for throwing me flowers. I appreciate you always. Thank you. You're always a star. Okay. And then also Miss Elle. You are fabulous, and I love everything about everything that you do, and you are just exceptional for our community. Thank you so much. And then also thank you so much, Miss Avant. I appreciate you and everything that you're bringing to the table as well. Thank you. And I smiled and I was so happy and blessed to see that video because I just love seeing us. I believe in therapy because, like I said, at one time I didn't, just like a lot of us, we give it to God and, we deal with it. And so it's just a blessing to have our voices, our faces, letting everyone know that it's okay and I do believe in therapy. And, it's okay. Come on down. So thank you all. This was lovely. And thank you, the community, for coming. So, make sure you get your videos on. Tell us how much you love therapy, how much you believe in therapy.
Yes. Thank you. So I believe in it. Kayan Wellness Center believes in it. And I think you guys already know that we have, free mental health for the entire community, warriors and their families, seriously, from ages 9 on up. All you have to do is just let your CHW know, and wham bam, within a couple of days, you are connected. I'm so excited, but I know how to keep a secret. All I'm telling you is that I'm working on a couple other things to support mental health. And there's some other things that I'm looking at to support our community. So I'm excited, been working on it. But mental health first and foremost. And you guys know we also have health coaching here at Kayan Wellness Center. And so with health coaching, that's when you said, I'm actually ready, but I don't know how to start. And sometimes I start and I don't finish. Health coaching will get you started, help get you on the straight and narrow, and to help you to actually finish. We also have that. And we actually have holistic naturopathic consultation as well. So I'm adding a few more things as well. Project Spirit, they actually have Christian counseling, and then some other things that I'm working on. Let me just share with you that this Friday we have Author's Corner beginning at 4 p.m. Pacific time. And then I also stated that April 30th, you definitely want to mark that date. 4 p.m. Pacific time, sickle cell and pregnancy. Everybody needs to be there. And that's put on by SC Red. I think that we have now come to the conclusion. I want to thank everyone that's here. So give me a moment quickly to just recognize those of you who are in our community. Of course, I'm going to give a shout out, right, to Etta Carter, right? You guys know that, okay? You know that. I'm going to do that. But also Carla and Kira, thank you. Sheila, thank you, thank you. We have, Renee. We have Miss Finister, Miss Marilyn, Alyssa. And this is only if you guys had typed in and let me know how you were doing. Remember, Stephanie, Cynthia, thank you for KW, Trinidad. Hey, thank you. We have, who else has been joining us? Put your name in the chat, you all. Put your name in the comments so that I know that you actually joined us quickly. Oh, Shar Brown, thank you for joining us. And quickly, you guys earlier had let me know how you were doing. Carrie Valentine, hey, how you doing? Georgiana, wonderful. Tarina. And so thank you. So again, this is what we do, you guys. And I love our staff that puts this on. So I do want to thank our tech team and our staff and the speakers. I hope you got something out of that. And so when I ask you how you doing, I really do mean it, and I'm going to pause and to wait. And if part of your response is that maybe you should think about speaking with someone, probably now is the time to do that and to consider that. We do believe in therapy here in the community, and we're thankful for the I Believe in Therapy team. And with that, we're going to say thank you. Have a good night, a good rest of your week. And till next time, goodbye.